Yeah, so on behalf of Learning General Surgery, myself, Dr. and Dr. Girija Sharan welcome you all to this afternoon session on evidence-based surgery. And I shall hand over to Dr. Rajan to conduct the proceedings.
Good afternoon, everybody, and it's nice to be on air in early in the evening. One of the important aspects of today's surgical care is the following of evidence-based practice or evidence-based surgery. Now, we have to confine our actions to things that we can prove are correct and the right way to be done. Of course, there are no 100% rules for anything, but the practice is such that we need to be able to justify our actions based on available evidence. This gives us the authenticity and the honesty of effort, as well as it protects us from further medical, legal, or other issues that may crop up. Now, this does not happen overnight, and we have to understand the importance of evidence in the way it is presented to us. We had two earlier lectures last week on the need for evidence-based surgery. And since most of the evidence is in form of statistics, we had another lecture by Dr. Ramakrishna from Bhadravati on some basic statistics and some principles of the use of statistics in research and the difference between audit and research. Now, since the evidence comes to us from journals, from articles, we must now know exactly how to criticize, how to evaluate, and how to understand what the article tells us, the genuineness of the study and the value of the study. And for that, we have got today's sessions. I'm so honored to have Dr. K Lakshman with us. He's the backbone, architect, spinal cord, neural system, cerebral hemispheres, everything of the EBS initiative in Bangalore, in Karnataka, and now we are taking it into the state. Grateful thanks to him for his efforts in trying to push what is an important aspect, an often neglected aspect of surgical training. Along with him, we have another senior surgeon, Dr. Ravi Shankar HR, who will then do on how to develop a study protocol and how to conduct a study. These are the two lectures for this evening. We will be having the lecture and then take the questions. If you do have questions, kindly type them out into your chat box and we will answer them at the end of each lecture. With that little introduction, I will not stand between you and evidence of Dr. K Lakshman, and he will now tell us how we go about looking at articles in the journals and evaluating them so that we will not make such mistakes when we write our articles. We will cover the things that are in gray areas with better black and white. Dr. Lakshman, over to you.
Thank you very much, Dr. Rajan, for your kind words. Let me begin by thanking the LGS, Patta Radhakrishna sir and his team for giving us this unique opportunity. Give me a second when I share my screen. Yeah, there we are. As Dr. Shiva speak, this is the third of 4 modules that constitute the evidence-based surgery workshop, and this deals with looking for evidence, critical appraisal, and how to conduct a journal club. I know that journal clubs are being done on this platform for quite some time now. I would like to stress that there is more than one way of doing a journal club correctly, and that what you're going to see today is the way we do it in our unit. And it is generally the way, and as I have not had the pleasure of attending your previous journal clubs, I know that I will make it a point to attend the subsequent journal club. But as I have not had the pleasure of having attended the previous journal clubs, you may find that it may be the same or it may be a bit different. But all the same, The idea is critical appraisal of a paper. So in the next 40 minutes, 45 minutes perhaps, we'll go through how do we even look at the papers that we want to look at, what is critical appraisal, and a very brief account of how a journal club is conducted. Now, any research study, be it your thesis writing or a study outside of the thesis where you want to have a presentation or write a paper up, will be focused on a selected topic. And it has to be an in-depth study. It can't be a superficial, superficial study which will perhaps help you write an answer to an exam question. It will be very much well beyond that. And it must necessarily have a good component of original articles. Now, for any subject to start with, be it your exam-oriented study or a study or a background reading for your thesis, you go through a series of materials, and of them, a basic textbook like Bailey and Love would be one of them, and then you graduate to a reference textbook. You then go on to compendia or editorials, and finally original articles on the subject. Taking you through these basic books, we all know about Bailey Love or current surgical diagnosis and treatment. These are things which give you very basic information, which is something which every MS or DNB student should have mastered. And then you go on to certain intermediate reference books like Schwartz or Townsend, as Sabiston, and then read up more about it for things that are more commonly asked in the exams perhaps, and go on to reference books like Mastery of Surgery or Mangoes. But by and large, my experience has been that postgraduates sort of stop at this level and do not go further. But in fact, at a postgraduate level, particularly when you're giving subject seminars or writing your thesis, as I said, or doing a research project, you will need to go well beyond this. And the first next step beyond a standard reference book is compendia, like Recent Advances in Surgery or Surgical Clinics of North America and the like. There are many such things. One of my favorites is the editorials in journals. You look at any standard journal like the British Journal of Surgery, or the Journal of American College of Surgeons, or Canadian Journal of Surgery. You will have very nice editorials. Usually these are invited articles written by experts in the field. While one may say that there is a potential for a bias, by and large, these seniors do avoid a bias and give you a well-rounded information of a very focused topic, and that will be a very recent and a very useful piece of information that you can have. And of course, review articles and meta-analysis in journals are the ultimate. They are the ones that are considered at the peak of the evidence pyramid. And if you are a digital person, like most of us are today, please remember to go for peer-reviewed sites. There are many, many sites which are not necessarily peer-reviewed. Individual surgeons, individuals themselves have sites which may be very, very colorful and which may be very impressive, but please remember that these are not peer-reviewed. And that is something that you cannot depend completely on. But the problem with journals themselves is that they're very expensive. So you may want to think about an institutional membership or through a digital library. One such example is the one at Bangalore Medical College. Whatever the source of your digital or printed information, go for indexed journals. This is the key word. Please understand that unless it is indexed, the material in that journal is questionable. I'm not saying they're not good at all, but it means that they're not peer-reviewed, and if they're not indexed, and even the indexes are of various qualities, and the ones that an index is basically a database, and the ones that you would like to depend on are the ones which are recognized by recognized bodies, like the MCI, for example. Index Medicus is a print version, but the electronic versions of the same is called the PubMed. You can have the SCI, the Thomson Reuters Index, Scopus, and DOAJ is making great strides. This is the directory of open access. So if you have a look at which index your particular journal is indexed in, the one that you're referring to, if it's outside any of these, then you may have to think twice before you depend on that. And of course, The impact factor of a journal is another factor that you would like to bear in mind before you consider whether a particular journal is good or not. The important thing is, of course, like everything else, like evidence-based medicine itself, evidence-based surgery itself, there are disadvantages of all this. People have manipulated these factors and these indices and things like that. But I do like to believe that these are outliers, and by and large, these factors are useful in knowing that a particular journal is of a good quality and it indexed in a good journal. Impact factor basically measures the number of times the journals, the articles in a given journal are quoted by somebody else. The presumption is that the more you are quoted, the more valuable your article is. And so a journal with a big impact factor will have many others quoting these articles from that journal. And so you need to go for journals which have a good impact factor. Pardon me, this movie is not moving for some. We moved on to the next one. Yeah. The Scopus is another index that you might want to go into. This is the URL that one generally uses to know whether your journal is good or not. Indian Journal of Surgery is indexed in Scopus. Unfortunately, I think just over a year and a half ago, Indian Journal of Surgery lost its place in the PubMed, but it's still indexed in the Scopus journal, and they have a different kind of index, and by that standard, its ranking is 17. Now, one of the common sites that you would look for your information is the PubMed. PubMed is from the National Library of Medicine in the United States, one of the very well-recognized things. And what I would like to do in the next 10 minutes is to tell you a little bit about how you search for articles in this. If you are looking for a particular article in a PubMed, this is the search URL for that, then you will have a lot of articles running into hundreds of thousands when you put a topic, a name of a topic in it. And so you need to have ways of focusing your search so that you get a set of articles which are manageable in terms of numbers. If you have 30, 40 articles, you can look at them, look at their abstracts, and then perhaps look at it more detail in a full text. Please remember that PubMed gives you only abstracts. It does not give you full text of the journals. The full text equivalent of the National Library of Medicine is the PubMed Central, what's called the PMC, and I'll tell you a bit about it in a little while. So the strategy for narrowing your search is to use what are called Boolean operators. There are 3 or 4 ways of narrowing your things, but Boolean operators, if you learn it a little, with a little bit of care and a little bit of practice, Boolean operators turn out to be one of the best and fastest ways of focusing your search. Fuzzy logic also works, but I would focus on Boolean operators. These are terms like and, or, not, and not, or parenthesis, or inverted commas, and things like that, that you put between search words. And remember that these are in capitals, and there's a space between before and after a Boolean operator. So you put a search term like gastric cancer, for example, followed by a space, a Boolean operator, and then the next search term, perhaps for surgery, things like that. I'll show you some classic examples. But for now, remember that Boolean operators are these operatives which include and, or, not, and you want to know more about it, PubMed itself gives you a lot more detail. I've given you just some examples. There are a few more operators, and you can get that information from PubMed itself. Now, using the or operator widens the search. So I would like you to focus on the search, the Boolean operator I have put there, and the number of articles that it throws up. Let us take an example of looking for articles on gastric cancer. If you say gastric or cancer, the search engine looks at all articles, titles, and the text of the article, which has the words gastric or cancer in it. So remember, it can pick up cancer of the pancreas also. It can pick up cancer of anywhere else. So if you want a wide term, you look gastric or cancer, you end up with 42 lakh articles on this search. But then if you take away that or and just put gastric cancer, it looks for gastric and cancer in the same topic, in the same article. And then you will have about 1.3 lakhs of articles for that gastric cancer. Still remember, it's a huge number and there's no way you're going to go through that. So you want to narrow it down further. Suppose I want to know surgery for gastric cancer. Now you put the same gastric cancer. Remember in the previous slide, it was gastric cancer with nothing else in it. But if you include gastric cancer within inverted commas, it looks for those two words next to each other in the article. That itself narrows it down. So it has, these two words have to exist next to each other. And you have also said and so it must, and surgery, and so it must look at articles which involve surgery for gastric cancer, which means that if it's an article on radiotherapy or chemotherapy, it excludes that. So remember that from something like 1,50,000, you're now down to about 29,000 articles. And you can do it further by doing the same thing. You can put this gastric cancer within brackets, for example, where these two words occur in the article, but then you are narrowing it down further to say laparoscopic surgery, not open surgery. So you put them between inverted commas and you'll end up with 842 articles. All right, so that is the way you narrow it down. You can narrow it down even further and then look at those abstracts to see which one would suit you. And this is a classic way in which you look for articles for your papers or for your thesis, for example, when you do it. As I said, there's another way of looking at the search, and that is the MESH term, which means medical subject heading term. PubMed has some standard medical heading. So when you open the window for PubMed and you click the down arrow, it gives you these MESH headings. And MESH headings can be used to narrow the search, and I'll take you through some examples. I'm looking at an example of an intra-abdominal hypertension. I ask for that as a MESH heading, and under that heading, there are many other subheadings. The whole area here gives you subheadings, and then you want to narrow it down. You can go for complications, you can go for diagnosis. Then when you press those, and then you'll end up, this is the search builder. You can see here that the MESH terms here, abdominal compartment syndrome, and in that, you're looking at complications and diagnosis. So you get a narrowed search and you'll get information from that. And you have to also think about fuzzy logic. Fuzzy logic is nothing other than writing whatever you want in plain English. Please understand that. One of the best matches for papers on what I've done here is just put my word laparoscopic surgery in gastric cancer. It throws up 79 articles. But remember, the last time we did the same thing through a different method, gastric cancer and laparoscopy using Boolean operators. We got something like 800? Some other kind of articles. So you find that fuzzy logic can be a little too narrow, and sometimes it can miss certain important articles that you would like to see. And so while you can use it in passing for casual deep reading, if you're really working for a research project, then you're much better off using Boolean operators. As I told you, the PubMed gives you only abstracts, and it is the best thing for you to do if you want full text is to go for PMC. Of course, many articles which figure as abstracts in PubMed will not be available in full text on PMC. But there are ways and means of getting full text articles. But if you want easy, quick full text articles, then the best thing is to go for PMC. Please remember that this search strategy, the search engine, is the same for both PubMed and PubMed Central. And this other thing that you can do is to, instead of even learning about Boolean operators, which is faster, you can also use the advanced app option for searching and the filter option for searching either in PMC or in PubMed. They are both the same. Now, the filter can be like this. You can see that you can restrict it to the last 1 year, last 5 years, or a custom range. You can even write last 2 years according to dates. So you can filter it the way you want it. It can also tell you whether you want to take out only those with full text articles, or only reviews, or only human studies and things like that. Such kind of filters can be used. And when you press on the advanced app option, you will find that it'll open up a window where instead of writing and or, you can actually type in with various fields what you want to do to narrow the field. That brings me to the end of the search strategy for journals. Rajan, do you want to pause here and take any questions, or should I go on with my critical appraisal?
As of now, Lakshman, there are no questions in the chat box.
Okay.
So I think you continue. Let us see what happens.
All right. So the next phase of this talk is to go on for critical appraisal of a paper. As Dr. Shivaram mentioned in his introductory talk last week, I think the pillar of evidence-based surgery, in the practice of evidence-based surgery, is to be able to critically appraise a paper. Dr. Rajan mentioned it in the introduction. The value of a paper, how good is the information on it, how much have we to follow it or not, is the subject of critical appraisal. It has been defined as the application of rules of evidence, and it basically assesses the completeness of reporting, the methods and procedures, and the conclusions and compliance with ethical standards. And so when an article has all these things in good measure, it becomes a good article. True that every article in an index journal goes through a peer review. And one may argue, when somebody else, experts, have reviewed it, where is the point in my reviewing it? But that would be a wrong approach, because every one of us is a reviewer in himself. Every student, every practicing surgeon is a reviewer. What he has to do is to learn to evaluate the paper. And one very interesting aspect of that evaluation, which I'm going to touch upon later, which no expert reviewer can do, is the capacity to review and understand whether it is applicable to your circumstances or not. That is an important part of every review process. Each one of us works under different circumstances, and we must have the capacity to assess our own capacities, our own infrastructure, and look at the conclusions of a given paper in the light of your strengths and your weaknesses. And no expert review panel, no peer can do that for you. You have to do it yourself. And that's why I strongly believe that when you read an article, in the first instance, postgraduates and practicing surgeons must read original articles, must read journal articles, and must go well beyond a textbook for their source of knowledge. That being said, they must have the capacity and develop the capacity to do critical appraisal. And as was mentioned, we take it a little further from the definition that was given. We evaluate the strengths and weaknesses of a study. Every study, original study, has a research question. And we next have to decide whether the design of the study, the way the study is conducted, is appropriate to answer that research question. What are the measures? Did they do the correct test? And as I go along, I'll give you examples for each one of these. Have they employed the correct statistical methods? Perhaps this is the most difficult test for aspect or step for all surgeons in the critical appraisal. But as we go along, we keep learning more and more statistics and try to get better and better at it. And extremely important, are the conclusions drawn supported by the data that they have collected? That is a very critical step. And of course, nowadays, we're always thinking about ethical standards for all studies. Now, if you look at the internet, if you read up about evidence-based surgery, there are very many different tools for different types of study. If you are evaluating as a reviewer, if people have been reviewers, they'll understand this much better than a postgraduate student. But remember, even for the beginner in critical appraisal, remember that different types of studies have different types of evaluation tools. A systematic review is evaluated in a given way. An original study is evaluated in a given way. A guideline, for example, is also reviewed by people, and that attracts a different set of rules. But by and large, there are certain fundamental questions that are asked of all studies, of all kinds of presentations and paper articles. And the job now in the next few slides is for me to explain those fundamental steps. You ask 10 or 11 questions of yourself about a given article, and then you come to conclusions. Is the study question relevant? That is the most important question that you want to have. If you are doing a journal club, or if you are a practicing surgeon, and if you are reading an operation, or if you're reading about a procedure you'll probably never see or do, then while it is a scientific and a surgical curiosity, that's not going to help you in your work. And so one of the things that you want to do when you choose an article is to see if the study question itself is relevant or not. The second way one can interpret the study question is whether that question is relevant for the given condition. Suppose you're looking at a very important, very simple question like a hernia surgery, for example. Now, if it is answered long ago, a particular aspect, like a well-established procedure, let us say Liechtenstein's procedure. It was a gold standard before laparoscopy came. And when it is established for a decade, and then you ask a study question, so is Liechtenstein repair really good? You know, when that happens, if that is the question that is asked, that would not be very attractive to anybody. It is established. So the question at that point would be, is Liechtenstein repair as good as, or is a laparoscopic repair as good as a Liechtenstein repair? That would be a much more relevant question. So start with the very fundamental issue, look at the question and say whether that question is relevant or not. And every question, of course, if you have a paper being published in a journal, it is likely that it will add something new. Otherwise, journals would, at least good journals would, reject these papers. But independently, as I said, it's good to ask this question. Please understand that this is a loaded question. Does the study add anything new? None of us are rocket scientists. You know, it's not that every day we surgeons who write papers discover something very earth-shattering, or which is phenomenal. All science gets better with very small incremental information of data. So anything new can be new for the population. Please understand that that is important. And as we are not very proficient or very active in writing papers, if you can collect Indian data, analyze Indian data, and publish them with a study which is already done in the West, in my understanding, that is still new, because it is producing Indian data, which otherwise we would not have had. So why do we have to depend on some Western data or Far Eastern data, something from Korea or Japan or wherever else, or Europe or US? We should have our own data. And in my view, the same research question posed in a new cohort, a new group of people, Indians would be new group of people. So if it's not done in India, please go ahead and do it, and let us have Indian data on a given subject. What is the type of research question asked? This is very, very important. There may be an intervention, or it may be epidemiological. We need to know intervention is when you're doing a given kind of an operation. Is tap better or is step better? That would be a research question. Also, you can always say, what is the frequency of events of any given condition? How many people, for example, in the Indian population, it has to be a large cohort in a given society. How many people have a particular kind of a gastric cancer or something like that? Those are epidemiological data. You can also have interventional data. And in that, in the intervention, you can look at either short-term or long-term outcome. Long-term outcome always involves large cross-sectional studies, which keeps on going for prospective studies, which keeps on going for a long time, which may be difficult for an average postgraduate. You would probably look for short-term outcomes, and a given unit and a given set of doctors in a given hospital would then go for long-term outcomes, year after year, or maybe every 2 years or every 5 years. A PG can look at the same cohort and get long-term outcomes. Now, was the study design appropriate for the question? If you have a frequency of events, for example, you need to have an observational study or a prospective study. The types of studies was touched upon by Dr. Shivaram in the previous presentation. If you're looking at effectiveness of either medication or effectiveness of operations, you would like to look at randomized controlled trials and prospective interventional studies. At least if it's not randomized, at least you must control, it must at least be a prospective study. So it's important that you design your study to suit the research question. And when you're looking at the evaluation of a paper, that's what we're talking about here in a journal club or in a critical appraisal, you need to ask yourself whether the researchers had the right type of study designed for the research question. Were the sources of bias addressed? And I think this is one of the biggest problems that we face in our studies. All I can say is give you a brief example of the kind of studies that we saw in our monthly meeting, for example. We had, before I go into that kind of study example, we can think of random errors and systematic biases. Random errors are very difficult to get rid of, but it's not too serious because it perhaps affects the precision of the study, which is important, but not as important as skewed results. Skewed results can be very, very misleading, and that is called a systematic bias. And systematic bias can be completely overcome by good thinking. As I was coming back to the example that I wanted to share with you, we had a paper from one of our young, bright postgraduates who was looking at the change in the liver function tests depending on the pressure of the intra-abdominal carbon dioxide insufflation. His working hypothesis was that if you have a lower pressure, like 10 millimeters of mercury, the effect of that lower pressure on the liver function tests would be lower than having a higher pressure like 14 millimeters of mercury. Now, it's a fair question. One may question, how does it matter if there's a transient liver function test? Did it matter in the long run? That he had not questioned. That was the very first bias of that paper. He didn't correlate the clinical effects of a slightly altered liver function test with the actual change in the liver function test. But lot more important than that was that he had not considered several other factors other than obstructive jaundice pre-op. He had ruled out obstructive jaundice, the LFTs were normal pre-op, and then he looked at the post-op LFTs. But there are so many intraoperative events that can affect the change in the LFT. For example, anesthetic gases affect the liver. Was halothane used? It's one of the potent gases which can affect the thing. So he had not ruled out that. That is a bias. There's a source of bias. Excessive dissection on the liver bed when you're actually burning through liver tissue. When you remove the gallbladder, it happens sometimes. That can affect the liver function test. Was there bile spillage during surgery? Well, these were three very glaring things which would have caused a bias for his reports, for his liver function tests, which were not addressed. And so when you're designing a study, you will have to look at these biases. And when you're looking at a paper and evaluating its usefulness, you must see that those biases were addressed by the authors. I won't go into this fairly complex looking chart, which is called a consort flow chart. This is now a requirement for all randomized controlled trials. I would like you to look at the internet to see what it actually means, but it is very simple. What it means is that through this kind of a chart, you're telling the reader that you have accounted for all the patients whom you recruited to the study. There will be situations when you do not recruit them, but you do not include them for your analysis. But you have to include all of them in a given group. That's called the intention to treat basis. I won't go into the details, but when you have included patients to start with according to your methods, if you exclude somebody for whatever reason, you have to explain why you excluded them. And that is done graphically through a consort diagram. Now, was the original protocol followed? This is very, very important. When the researcher puts out his protocol in a research methods, in the methods section, when he describes that at no point in time across the conduct of the study, at the conduct of the study, should he change the rules that he set for himself, because any change in that rule will affect the outcome of the study and will erode into the validity of that study. So the things that you have to check when you're reading a paper: did they have adequate numbers? There is the sample size calculation must be done upfront, for the kind of change that you possibly expect from your two groups that you are comparing. For example, a minimum of 30, a minimum of 70, a minimum of 70 or 80 patients should be studied in each group, would be your sample size. Did they meet the sample numbers? Did they actually stick with their inclusion and exclusion criteria which they would have defined? And what was the duration of follow-up and the type of intervention? They would have said we would do this kind of an intervention. Did they really stick by it? For example, when you're looking at the outcomes of a hernia repair, they would have said that all the operations were done by surgeons who had a minimum of 5 years of experience in the given operation. Now, when they are actually doing the operation, when they're doing the study, they'll have to mention it, and you have to check whether it was really true that all the operations were done by these experienced people, but were they also using them for training youngsters, which may in fact, it may not impact on the complications, but it will definitely impact on the time taken for the surgery. So in essence, you have to look for explicit mention by the authors of their adherence to the criteria laid out in the methods section of the paper. Now, does the study test the stated hypothesis? This is a very important aspect that you need to do. As I told you, every paper has a research question. There is a hypothesis, we call it the null hypothesis. You start off with the point, with the presumption that there's no difference. Is TAP better or TAP better in terms of short-term outcomes of a laparoscopic inguinal hernia repair? Now you start off with the null hypothesis that one is not better than the other. All right, but when you do the analysis, if you do find that perhaps pain is, I'm not saying it is so in real life, but I'm giving you an example. Suppose you say that pain is better, pain is worse in TEP compared to TAP, for example. Then your null hypothesis doesn't hold true anymore, and then you say, look, pain is worse in TEP, and so perhaps you should consider doing TAP. That would be your conclusion. But please remember that that conclusion must be based on complete reporting. All the people who were in the TEP group must be included in the TEP group. All the people who are in the TAP group must be in the TAP group. They must also look at conversions, conversion from TEP to TAP, conversions from TEP and TAP to open. And in the analysis, all those people who they started with must be included in the total number. That's called the intention to treat basis. Somebody gets transferred from TEP to TAP, and then you shift them from the TEP group to the TAP group, would be incorrect. Was something like that done is something you should always bear in mind. And the post hoc analysis is something you should be very, very careful about. People do it very often, and that you should be careful about. What does it mean? Now you start with a given set cohort of people, you find that there is no difference. There is a wrong notion that if there is no statistically significant difference between two groups, your paper will not be accepted. That is really not true. Most journals today, when you say that there's no difference between two procedures, that itself is good information. So people do accept it. But because of this business of no statistical difference between two groups, then as an afterthought, after the study, the researcher starts saying, look, how can I make it important? How can I make it significant? Then he will look at subgroup analysis. He creates groups which he didn't have when he started off with the original hypothesis, with the original study. And so that is called a post hoc analysis. And these subgroups, then he will find some kind of a statistical significance and reports it. When that happens, most of the time that will not be accepted by the reviewers. But if it slips through the notice of a reviewer, then you as an independent reader of the article must be looking for and rejecting the conclusions from such post hoc analysis. This is perhaps the most difficult for you, for me, not just you, for all of us, where the statistical analysis performed correctly? Were the correct tests applied? Some of the basic things can be looked at and understood by most of us. But if you're really worried, perhaps you should talk to a statistician to get further information. And data justifying conclusions. I mentioned it at the very beginning of this section of my talk. That is something which we need to have. Time and again, we see our youngsters having 5 or 6 conclusions in their conclusion slide. And they will have studied and analyzed data on only perhaps 1 or 2 of those aspects. It stems from the wrong presumption that your work will be better accepted or more impressive if you have 4 or 5 conclusions. Completely wrong. A single conclusion, one-line conclusion based on solid data that you have generated and analyzed will be a lot more useful than having 5 or 6 conclusions with no data. That is something that we really have to understand. And nowadays, particularly, it doesn't generally apply to our postgraduate work, but for practitioners and people working who produce papers, conflict of interest is very important, because you may have shares in a company, you may be a paid consultant to a company. And obviously, if you are doing a study on a hernia mesh that company produces, well, you may not be biased, but at least the reader must know that you have such a position. That is a conflict of interest. And it is for the reader to decide whether he wants to listen to your, believe your data or not. But from our side, when there is industry funding for a given study, it is important that we declare upfront possible conflicts of interest. So critical appraisal is an extremely important aspect for all of us. It improves with practice. You will find that from a first year PG to a third year PG, the way they start doing the journal clubs, it is extremely, the change that they go through is very clearly visible. They feel pretty lost in the beginning, and by the time they reach year 3, they become masters at it. They know how to do it. It is best done in journal clubs. My next section tells you how we do our journal clubs. It helps you design your protocols. That's very important. When you keep doing critical appraisal or original articles of recent journals, it not only gives you good ideas for your research work, and such ideas are always required. With 2 DNB students intake in our hospital every year, we find it pretty easy to give them a thesis topic as well as 1 or 2 research topics for work other than the thesis, quite easy, which means that we need to look at 6 or 8 original studies. But imagine big departments in big colleges with 30, 40 postgraduates. My heart goes out to those teachers for them to find 40 original topics for the students to work on is a huge challenge. And I think if one way they can meet that challenge, at least partially, is to keep reading papers and getting ideas from that. And once you fine tune your critical appraisal, your writing becomes better. You understand what the problems are, and so you will write better, so that the chances of your submissions being accepted are very good. Rajan, can I take a break here if there are any questions, and or even comments from all the seniors here, yourself, Shivaram, Patta, Radhakrishna, Bhavin, all of you. If you have any comments or any suggestions to the PGs,
sir, there are some question on Facebook Live going on simultaneously on Learning General Surgery.
Okay.
One is that what should be the score of good impact factor? I think they are asking about some kind of citation score.
Yeah. You see, I'll give you an example. There's no fixed factor for this. British Journal of Surgery, for example, has an impact factor of 5.6, if I'm not mistaken, about 5 or 6. Indian Journal of Surgery, for example, has a impact factor of 0.5. The best impact factor that we wrote a paper about it. One of our postgraduates looked at Indian authors in high impact journals, was in JAMA Surgery, which had an impact factor of 10. But please remember, there are different scores, and you need to, just like the lab values, you must look at the impact factor for the different indexes that you refer. The numbers that I gave you are for PubMed.
Sir, another question from my side, and for younger people. Now I am more than used to it, but in initial career, how to deal with the rejections?
It's a good one. The only consolation I can give you, Bhavin, is that our paper, two of our what I thought was good papers, were rejected as recently as 3 weeks ago. So rejection is a fact of life.
Yes, sir.
Please understand. Nobody
Nowadays,
need. Yeah.
nowadays, if my paper accepted in first go, I am surprised and look at the paper. It must be a bad quality paper or bad quality journal, I think.
You're absolutely right. Rejections are a way of life. Please understand that most journals work on the principle that they must accept not more than 30% of their submissions. 70% are actually rejected. And so you need to have a bank of journals under your belt. And if one person rejects you, you send it to another person. Somewhere, somehow, maybe on the second, maybe on the third, maybe on the fourth attempt, it will get accepted. Also, when they reject, good journals give you a good critique. They tell you why it is rejected. Please take that very seriously. So I always do that. When somebody gives me a good critique for a good reason for rejection, I alter the text to meet the critique or the objections that those reviewers raised. Change not the data or anything, the way I have presented my material. I change that to suit a good point of rejection before I submit it to another journal. And more often than not, it will find favor.
Sir, another question based on the same question. How to select journal means how to select appropriate journal for your paper, considering your paper.
Correct. Uh, these are actually discussed in a journal, in a workshop, which is a bigger version of what we have been giving here. The best thing is you must look at your topic. Okay, if it has a global appeal, then you can go for international journals and see what you can do. We had a paper on the emotional aspects, or what's called the pain catastrophizing behavior of people. These guys who are very anxious, they exaggerate their pain. There's a psychological score for it. So we scored it pre-op and then looked at their post-op pain. And that got accepted in World Journal of Surgery. Okay, that kind of a topic. But if you have something very local topic, for example, Indian authors, the authorship of Indian surgeons in world journals in high impact factor world journals. Now that would not interest the world audience. It won't interest a global audience. It has to be necessarily put into an Indian journal. So the first thing is that. The second thing is the kind of study that you have. If you have a laparoscopic surgery, for example, Indian JMAS, Journal of Minimal Access Surgery, would probably be an appropriate journal. And the third thing is to look at the impact factor. Of course, I have a particular bias towards Indian Journal of Surgery because I'm involved with it, and we would like good journals to come there so that we can come up and qualify for the PubMed indexing, which will come up in the next year or so. But it's good to encourage our own national journal. So I would recommend everybody to try and have a go at Indian Journal of Surgery first. But what is more important is what you should not do. And that is to go for predatory journals. There are lots of them out there without any peer review. If you pay 6, 7, 8, 10,000 rupees, they just publish your papers. They're not indexed in any of the recognized journals. It is bad to have that practice just because you want to publish a paper. And if you're trying to meet an official requirement like an MCI requirement or a Rajiv Gandhi University requirement, these journals are not accepted. And so even if you may say that you have a paper published, it will not be officially recognized.
There's a little query on how do journals pick up their reviewers? Are there any criteria or standards that the reviewer must meet to be able to look at articles and give his criticism? Is there any criteria?
Yeah, one of the commonest criteria people use, journal editors use to pick up reviewers is those people who have written articles. If they have published articles in reviewed journals, then they know that these guys are very active in the field, and so they'll choose such people. Of course, it is not a must. They may also know personally good teachers, good seniors who are seeing youngsters through the process of research and writing. They may also be accepted. And the third thing, which has now become global, which is very, very important, is the review itself. The reviews that people write are being now broadcast across the world. There are things like Orchid and Publons, where your review will be published if you want to. For example, I have permitted everybody to publish my reviews in the public domain, for example. So Publons and
Okay.
Orchid have these things published, and all the review journal editors will be looking at it. And so, for example, out of the blue, when I had not asked for it or anything like that, the British Journal of Surgery asked me to review one of their papers. And similarly, there are so many other journals who ask you to be a reviewer based on this kind of track record. It's left to you to choose or not choose to review. But the process is pretty transparent, and it does involve, I think, publication by the reviewer himself. He should be an established writer of articles.
Just to add on that, what you said, some journal, particularly International Journal of Surgery, for a paper recently I reviewed, they award reviewer in the term of, they asked me to put an invited commentary, and that's the official PubMed Index publication now they are promoting, because you are telling about it. So some journals do encourage this kind of thing.
Correct.
There's also another question from Dr. Mahesh, who's asked about the paid international journals.
Yeah.
As you rightly have mentioned, these are predatory journals who are waiting to make money and are of no value. They suddenly came into prominence because of this demand by institutions saying that unless a paper is published, you're not getting your promotions. And so a large number of articles started coming out, and the people had no avenue to get the word published. So these people set up journals of very fictitious and uncertain standards, and started accepting these articles and putting them out on the net. These are not reviewed, or these are not on indexed, and so they don't have much value, because there are people who are paying a lot of money to get these things done, and it is not acceptable.
I would like to add two things to that. Not all payments are through predatory journals only. Several major journals, because of the cost of publication, because to be very honest, they want to make money, demand payment for publishing the articles. All right, but they do give you an option to write off your intellectual property rights to them, and then there are many methods. I'm not going to go into all the details. There are many options, but for brevity, let me just say that all payments are not illegal, nor is it predatory. There are some good journals which demand payment, and sometimes the payment is very large. I can only say that I have not paid for any of our papers. I'm very clear about it. If it doesn't get published, it doesn't get published. But you can pay even in good journals. But to know that it is not a predatory journal, even if it's an open access journal, please go to DOAJ, that is the Directory of Open Access Journals. If the journal that you're looking at is listed on DOAJ, it is not a predatory journal.
Thank you, Dr. Lakshman. That
has
been a very interesting 45 minutes of talk and some little discussions. And we have one more very interesting topic of how it is actually done, and how do we go about setting the study protocol, and how do we proceed in developing a research project study, or that may lead on to a paper. So I invite Dr. H.R. Ravishankar to come forward. He is a senior consultant surgeon at the Sagar Hospitals of Bangalore. a very renowned and voice of value at all our meetings. And he has an academic tilt, and I'm sure he's going to keep us on the right track as we go through the rest of the evening. Dr. Ravi Shankar, sir, please.
Yeah.
Ravi, you ready?
Yeah, I'll try. I'm starting to share the screen.
Ravi, you may have to log in again.
Okay.
Or if you prefer, Ravi, I can put up your presentation.
Actually, it is there. I don't know why it is not sharing.
Then why don't I do that? I'll just,
Yeah.
I can, okay? I'll do that for you. No, I'll have to come out of it. I'll stop sharing just for a sec. I will. All right, are you seeing that now?
Yes, sir.
All right, there you are.
Yeah. Okay. Now I think a lot of these things in passing has been actually touched upon by Dr. Lakshman, but this is just to elaborate on certain important aspects of how to put a research protocol together and how to write a paper. I think in a lot of what is there is already initially been touched upon. So let us just go into the nitty-gritty of how to write a protocol. So first of all, whenever you want to do a study, the most important thing is that you have to be enthusiastic about doing a study. And it also comes with a fact that a lot of this study is going to be hard work, it is painstaking, sometimes it's frustrating, and many times the results the results you are hoping for may not necessarily show. Dr. Lakshman said that whenever you actually start a study, you want to show the difference between two sets of patients, and you may not necessarily show them. But it still does not make it a bad paper. It is important to think that you have actually proven that, for example, there are many studies which show that TEP and TAP, there was a lot of talk and a lot of discussion about whether TEP is better, TAP is better, but multiple studies have actually been done, and many of them have actually shown that there is hardly any difference between the two, and ultimately it boils down to the choice of the particular individual surgeon or a particular situation. For example, there are certain situations where TAP is better, so you do TAP then. So basically it is, we have to understand that research does not mean, as Dr. Lakshman again alluded to before, it does not have to be groundbreaking or earth-shattering kind of research, which is very, very rare. You hardly ever come across such research. So it does not again mean that you have to slog in a laboratory which is dimly lit all through your weekend and 24 hours a day. Some of the molecular biology researchers and very basic science research may be like that, but most of us are not going to do that on a regular basis. We may take time off when we were doing post graduation to do that research for a period of 1 or 2 years, but by and large we don't do that kind of research. So don't get put off by research thinking that it is something which is going to change your life or make your life miserable. Many of the researches that we are talking about are clinical researches which can be done alongside your day-to-day clinical work. So the first important thing is for you, for us all to have that research bent of mind. We should have an interest, we should have the dedication, and we should have the inclination to do research. And research does not have to be all consuming. I mean, some people, when it is actually very good, it may become so, but even then it is very enjoyable. So that is very important. So we shall all do research because we want to do it. So the first thing when we do research is about the protocol. So what is actually a protocol? It is the plan of action of the whole research project. So this has to be put in great detail. And the great attention to detail has to be seen in a protocol. So you have to think about all the possible things that need to be there for you to do this particular research. What are the things which can be confounding factors? What are the factors that can cause errors? Where can you go wrong? First of all, as Dr. Lakshman said, is this research question relevant? Do you need to do this research at all? If so, why? And then you have to look at all other aspects which can contribute to the success of your particular research. So all these things have to be laid out in explicit detail, how you are going to conduct the research. And first you raise a research question, and then you have to collect what information is already there about that particular topic, so that you don't have to repeat whatever is already been done. But on the other hand, if this particular research has come from another country, then you need to think, is it applicable in our circumstances? Can I actually follow what these guys in America or in England say? So in that case, you can transport what is there in that particular paper to our cohort, our group of our patients, and see whether it is applicable. So then it becomes a valid research question again. And then you have to formulate a hypothesis, as he said, null hypothesis. So to just again reiterate, what is null hypothesis? A question, for example, is TEP better than TAP, or laparoscopic cholecystectomy better than open cholecystectomy? So you presume, you start off saying that both surgeries are equal, or they are the same in terms of all the things that you are thinking of for the research question. That so null hypothesis is there is no difference between the two procedures. So if you prove that TEP is better than TAP, then you have actually rejected the null hypothesis, and then you can actually say why you have rejected the null hypothesis. What was the the confidence interval? What was the the statistical difference between the two groups? So you formulate a hypothesis, then you have to design a methodology to test the hypothesis. So for example, if you are designing a comparison between TEP and TAP, as again Dr. Lakshman said, you have to have a group of surgeons who are, for example, maybe only doing TEP, and then there are a group of surgeons who are only doing TAP. So, and then they should be of equal competence in terms of the numbers that they are doing, in terms of the experience they have, so that you don't bring in a major confounding factor. For example, if there are in TEP procedure, if there are surgeons who have just started out, and in the TAP procedure who have surgeons who are very experienced, then obviously there can be a difference. I'm not necessarily saying that there is a difference, but there can be a difference. So that can become a confounding factor. So you have to ensure that the two groups you are studying are comparable in terms of the experience, in terms of the numbers that they have done. And so you have to design the methodology to suit the testing of the hypothesis. And then you have to define what are the requirements for the study and what are the limitations of the particular study. And then you have to look at this in the ethical aspects of it, and then make sure that you get ethical committee approval for the study. So when protocol is needed, because you have to have a clarity of thought. So if you are the single investigator, then obviously you know exactly what you're doing. But if there is a group of investigators, everyone should be singing from the same hymn sheet. So you should know exactly what is the question that you're all asking, what is the answer for the question that you are looking for. So basically, all of us should be clear about what the particular study entails. And then again, then you have to obviously prepare a proper protocol, and the protocol has to be, because you need it, because the ethical committee has to go through it and say, what are you doing and why are you doing this? Is it necessary for our hospital or our group of patients? And are there any particular ethical aspects to this study? Is it, for example, if patients have to pay about 4,000 or 5,000 rupees for a particular test, and that has to come from their pocket, then usually the ethical committee will not give an approval for that, because it is wrong for you to charge patient unnecessarily for something that probably doesn't benefit them. So you have to make it cost neutral. So there are lots of aspects. And then again, if for example patients are going to be harmed with this particular procedure, ultimately which they may benefit from, again the ethical committee will have questions about it. So you need to be able to justify the particular procedure to the ethical committee. So you need a protocol for you to get an ethical committee approval. And in case you are expecting or wanting external agencies to, there are a lot of companies which may be able to fund your research. They need to know why you are doing this research and what is the benefit of doing this research. So you need to have a proper protocol for you to submit to them, for them to, then you can go and explain to them the need and the methodology of your research, and then get approval for the funding. Okay, so the protocol format usually entails a project title. So you have to write a title, and then the summary. The summary should contain everything about that particular project. Then in elaboration of what you have written in summary will be the project description, which will in the subheadings of rationale. What is the rationale for this particular study? Why are you doing the study? What are you hoping to achieve? What is your question? What is the expected answer? And then again the same is about the objectives of the study. So what you at the end of the study, what are you actually expecting to prove in your study? And then you have to detail the methodology. How are you going to go about doing the study? What is the protocol? What is the length of the period of your research or your study? And how are you going to recruit your patients? At the end of it, what are the data that you are going to collect? And then what are you going to what is the primary endpoint, secondary endpoints? All of these things have to be detailed in the methodology. And then you also have to make put in place a data management and analysis system, because the data has to be collected, collated, and then rechecked and checked and rechecked again. Ensure that the data collection system is foolproof and it is all in one place, and it should be verifiable by another person. And then you have to also do analysis, and then this analysis will be in the form of statistics, and you also detail them also. And then ethical consideration I've already explained again there before. So you have to make sure that the ethical consideration are there, and then any gender issues have to be addressed. And then finally the references to the particular research that you're going to do. What is the reference that you have collated before, so that you can carry your research forward. Okay, so the title has to be concise. It should describe exactly what your study is going to be. So it has to be, preferably it should be elegant, it should be concise, and it should make the people who are looking at your study, arouse their interest, and they should be able to look at your study. So by and large, I'm not saying it has to be flashy, but it should be, it should, catch the attention of the person who is actually looking at your study. So it should convey what is your study about and what is it looking at. So the summary again has to describe the project in concisely, and it should cover all aspects of the study. For example, is it a randomized trial? Is it blinded, double blinded? And what are the endpoints, primary endpoint, secondary endpoint? What is the methodology? What are the statistics that you have used? So all of those things should be contained in the summary. And the study, it should make sense all by itself. For example, once you look at the summary of the study, you should know what exactly that study is hoping to achieve. So now you come to the project description, which is elaboration what you have actually pointed out in your summary. So the rationale of the study is the introduction. For example, if you're looking at, let us say, comparison, again going back to the TEP and TAB, we have a lot of sort of data from the West, from the United States and from Italy, from England and everywhere else, about the comparison between the two. But we have not had any necessary Indian data about this. So if you want to do that, then you collect the data that is there already in the net and in the PubMed, and say this is what the study says, that TEP is better or TAP is better, but we don't have data from India. Because there are lots of things. One, whether it is applicable to Indian population. Are Indian surgeons as good as the Western surgeons? And if you have done the study well, again, it projects India. And let us say we publish it in Indian Journal of Surgery or any other journal of surgery. It then people will start quoting good research from India as well. So we start getting recognized elsewhere. And so that is extremely important. So that is why you have to state why are you doing this particular study. And then when it comes to the objective, what is the particular research question? TEP better than TAP, or are the two procedures equal in their efficacy, both short term and long term? So the primary outcomes, for example, primary outcomes look at, let us say, recurrence rates at the end of 2 years or 5 years, or for if you want to do a short term study, recurrence rates at the end of 2 years. And then other important aspect of hernia surgeries, complications like seroma, mesh infection, and surgical site infection, and also chronic pain. So these will become the secondary outcome. So you have to state what is your primary outcome and what are your secondary outcomes. Then the administrative responsibilities. For example, you have to lay down in your project description who is in charge of randomizing the patient, how do you randomize the patients, and then who is in charge of doing what, who is going to collect the data, who is going to analyze the data, who is going to the statistical analysis, how are you going to get the funding, and who is going to interact with the people who are going to fund the thing, and who is going to get the ethical committee approval. So all of these things have to be, administrative responsibilities have to be delegated and have to be included in the project description. Then coming to the methodology itself, you have to describe what are the patients involved. For example, all patients between the age of 18 and 80 years of age. So you have, and whether it's male, female, whatever, you have to describe the cohort of patients we are studying, and then the sample size. So this is again a very important thing. The sample size is critical because if you are studying something, the difference statistically is going to be small. You do need a huge number of patients for you to actually prove that the statistical difference between the two groups exists. But on the other hand, if you are going to have a very focused kind of thing, then you will not get, for example, if you want to show that a drug A is better than drug B in treating hypertension, you need a large cohort, and hypertension being a common problem, you will get a large cohort. But if you are looking at hernias and TEP and TAP, for you to show a difference between the two groups, you may need a significant number of patients, because most of the time, as we know, currently the statistical difference between the two is not so much. So you do need a lot of patients for you to show a difference. So you need to have a sample size. So if the sample size is not adequate, then your study will fall short of what it's actually hoping to achieve. So to overcome that, what you can do is to have a multi-center trial where you recruit many other centers, so that numbers can be, and if you set the protocol correctly and you discuss amongst yourself and there is good coordination, you can have a multi-center trial so that you can have the adequate numbers to actually show a statistical difference between the two groups. So that is how you have to plan the sample size. And then the study design, again, whether it is retrospective, prospective, cohort study, randomized trial, randomized double blinded. So all of those things have to be described in the study design. And what is the intervention that you are going to do? That has to be very detailed. For example, you have to in detail tell us how you are going to do a TAP procedure, that is including the anesthetic and then the anesthetic drugs that are used, because both of them have to be the same, and the pain management during the procedure post-operatively has to be the same. And then you have to describe how a surgeon is going to do a TAP procedure. It has to be, sort of commensurate with what is accepted as international standard. And then again, the TEP procedure has to be done in the same way. So that you have to describe the whole intervention that you are going to do, how you are going to manage the pain, how are you going to assess the pain. All of these interventions have to be very clearly stated. And then outcome measurements, you have to state what are you going to do. Are you going to look at pain in the immediate post-operative period in the first 24, 48, 72 hours, and then 7 days and 1 month? So that is the acute situation. And then complications in the acute time, if it is a short-term study. And then you have to state these endpoints very clearly. And then you have to also look at the frequency of observation. For example, if something is happening frequently, then you have to, it obviously makes a difference. But if something is happening very rarely, then those observations may not necessarily have much impact, or it may be just a random happening rather than something related to this particular procedure. So coming to the again the data management and analysis, as I said, the data has to be collected and it should be properly managed. So the data collection has to be responsibility of a particular person, and it has to be checked and rechecked on a regular basis. And how the data has to be managed, it has to be confidentiality has to be maintained, and you have to obviously put it in the computer database and spreadsheets. And statistics have to be statisticians have to be consulted on a regular basis as the data is being collated, and then the appropriate statistical methods have to be applied, because if statistics is wrong, then wrong conclusions can be arrived at. And then you also have to in detail say what is the software that you are using for the statistical analysis, because one, that you are actually sharing your information with others, and also if somebody else wants to do this study, they should be aware that this particular statistical package that you have used is what they can also use. So it will help them to conduct a similar study in their particular condition. And then again, coming to the ethical consideration, you have to maintain the confidentiality of the data, and patient should be convinced that their information is not being spread elsewhere. And the reporting has to be complete. You cannot sort of hide certain data and so that you can show that your study is good, but that is why it is important to report your data completely. And as I said before, informed consent has to be taken, and ethical committee has to be consulted, and their approval has to be sought before you start the study. Again, budgetary consideration is also important. So you to ensure that budgetary considerations are already in place before you start the study, and make sure that patients are not being burdened with the with extra tests and things like that, so that your ethical committee will give you the approval. Now coming to the informed consent, when you go to the patient, you have to, in their own language, explain to them the aims and objectives of why you are doing this particular study, and what are the things that you are doing to, in terms of interventions, for example, an operation, in terms of putting a cannula, and then pain management. All of these things have to be explained to them in their own language, and then what are the effects of these particular things that are going to happen, and that you are randomizing. So it means that there are two methods, two things that we are studying, two particular methods, and you will be randomized between the two. So they should accept both forms of treatment, because if they are not ready to accept both forms of treatment, then they will not be ready to be taken into this particular study. And then the costs involved, as I said, by and large, you should avoid costing the patient. But if you are going to do that, you should take their prior consent, so that if they are willing, then it is okay to do that. But they should be fully aware if before this study, start the study, and then how many visits to the hospital that they may need to come for. Will you disturb them with the telephone calls? What all of these things have to be told to them, and you should make it very clear to them. There is no obligation for them to participate in the study. They will be treated in the standard manner, no matter what. So they should not feel that if they are not part of the study, they will not be treated properly. So they should voluntarily, with their full volition, will be willing to participate in the study. And they also should be told that they can opt out of the study at any time without giving any explanation or warning. So that is important in terms of the informed consent. So now let us come to the how to conduct the studies. Let us stop here and see if there are any questions that we can take. Dr. Rajan sir.
As of now, there's no questions in the chat box, Ravi. So just continue. You're flowing smoothly. Carry on and finish. Let's see at the end what comes up.
Okay. So let us now go to the question of how to conduct the study. Right. The steps in conducting a study will be first of all, once you have written a protocol, so you need to get a scientific committee and an ethical committee approval. The scientific committee will look at the scientific content and the scientific veracity of the particular study. They are not generally involved in looking at the ethical aspects of it, but is the study scientifically sound? Are there any problems with the study and things like that? So the scientific committee will look at those things, and then they will give you an approval. And then you have to also get a approval from the ethical committee. So these are mandatory for conducting a study. And then the permission from the institution, the head of the department of the particular institution, and also the individual consultants and unit heads. Because if just taking a consultant head of the department's approval is not good enough, because all consultants who are in the department will be contributing to the study, either in form of actively participating in it or giving their patients for the study. So it is important to get explicit consent from all the consultants and unit heads, and from the patients and subjects also. So when you talk, as I said, when you take the consent from patients, spend time to them explaining the project and why you are doing this, and give them a printed copy of the consent form and also an explanation to go with it, and let them take their time. They don't need to sign it immediately. Let them go through it. If they have any questions, please answer them. Make sure that they are fully conversant with the whole procedure, and make sure that they are not under any duress or pressure to go through with the study. And you have to reassure them that they will be treated for their condition no matter what, whether they take part in the study or not. So these are very important things. And then get the signature and a witness also. Then you have to register your trial with the Clinical Trials Registry of India. This is becoming now mandatory. It used to be mandatory in the West, where there is trial registries in the respective countries, but it is now becoming mandatory in India also, that you have to register your trials, so that it gets a validity and a seal of approval, because it's part of if some governing body, whether it is just a body which has got no let us say punitive powers, but still being registered in a clinical registry of India, indicates that the trial is of certain value and content. So that is very important. So what is the CTRI? So CTRI, this is the website, and this is the URL link to that. So you can go and have a look at it. There is also tutorials by the CTRI as to how to conduct the research, and they actually conduct it as modules over a period of 6 months, 9 months, and 12 months. And some people here might have attended them. So I think that gives you a much more in detail and practical way of how to actually conduct a trial. And it is good to register your trial with the CTRI. So this is again the e-tutorial on the CTRI website. These come in various modules, and it will take you through the process of doing a trial. And by and large, these are for drug trials and things like that. But as surgeons, we may not necessarily need to look at this, but it is optional if you want to look at it. I think there are people who in the last seminar said that they attended this for a period of 9 to 12 months, and then they took exams to complete this. So I think this is something worthwhile to look at. And coming to the master sheet. So the master sheet is the spreadsheet on a Microsoft Excel, where basically all the data that you have are recorded. Again, they can also be recorded in Google Forms. This is again becoming very popular. So Google Forms, I think Dr. Lakshman is looking at how to use Google Forms in doing research, because it makes it user friendly. So Google Forms are really a very good useful addition to the process of research. And to document all the data points. You may not think something is important. See, the importance of doing a proper research is the data should be there, and it should be verifiable, and it should be auditable. So somebody looking at your research should be able to say you have actually covered all bases. So it is important for you to document all data points, however trivial they may sound. All the demographic details, investigation details, intervention details have to be, and then the outcomes have to be classified into primary outcome. Usually the primary outcome will be one, the important single question that you've asked. And then there are what we call as the secondary outcomes, which are you didn't actually look at them as the primary thing, but as a collateral, you've got a lot of other benefits also. So secondary outcomes, and for example, if you're looking at recurrence rate between the TEP and TAP, and then chronic pain, seroma rates, complication rate, mesh infection rates, they all become secondary outcomes. So that is how you look at it. So you have to have one single primary outcome, usually. Sometimes you may have two, but by and large it's usually one. And then you have secondary outcomes, which could be of one of many things, usually 2 to 3 up to 5 can be secondary outcomes. collate all data of the groups and subgroups. So as Dr. Lakshman previously mentioned, for example, when you find that your two groups are similar in terms of the result, then you have to try to do what is called as a post hoc analysis, looking at subgroups, trying to prove that your study was actually very useful. But if you want to actually subvert this, and if you want to actually prevent this from happening, you can actually initially itself state what are the subgroups you are going to analyze to look at these particular aspects. And then if you show that the subgroup analysis showed that there is a difference, then that is acceptable, because you have already done that even before you preempted it, before you actually did the study. So you are not biased about the subgroup analysis. So it is important for you sometimes. For example, if you are looking at wound infection rates, you can look at it in the general group, and you can also subgroup it to, for example, to include diabetics and maybe people with immune suppression, to see if there is any difference between the two groups. So you can do that by stating that subgroups initially itself. Okay, now coming to the data analysis, and you should always try and get your colleagues to come along with you for the co-opt your associates for the data collection. So that once you have collected data, then you also have to make sure that you liaise with your partners in the laboratory and wherever, for example, radiology, whoever you are going to help. For example, if you are looking at CT scan for diagnosing Meckel's diverticulum or acute appendicitis, you should obviously get your radiologists on board and ensure and tell them what is exactly required of them, how should they report this, whether they are going to be blinded or not blinded. So all of these details have to be done before, so that your analysis of data becomes easy. And then, so you also have to, as I told you before, we should have a system where the data is double checked, triple checked, so that the veracity of the data, the completeness of the data is important. And then it is again, this is a very important point, interim analysis every 4 to 8 weeks. If your study is for a period of 2 to 3 years, you should do interim analysis every 4 to 8 weeks. So that is one for us, for you to know how is the study going, and also for you to actually keep reminding yourself that you are doing a study, and you have to be constantly on the lookout, to recruit patients for the study and to ensure that you have adequate numbers. So then you should look at how the work is going on. Is the data collection good? Are you getting enough patients to be recruited for the study? If you are not getting enough patients, then you should look at how you can augment the numbers. Or actually, you also have to ask the question, will you get your adequate numbers at the end of 2 years for you to actually complete your study? So then you have to relook as to how you can actually change. You cannot change the protocol, but you can change the strategy to recruit your patients. And then you have to recruit, iron out all the difficulties in recruitment and data collection. And then you also look at the feasibility of the particular study and how you can ensure that the study is feasible and possible to run smoothly. And then it will give you trend in the outcomes. Sometimes it can throw up, for example, as many of the studies have shown, some of the, for example, some of the trials showed that the particular drug had complications, cardiac complications or whatever, and they had to stop the trial in between. So these occurrences are rare, because generally when you go through the phases of the trial, you would have picked up these important differences or important complications and problems. But sometimes, unexpected results and unexpected events may happen. So you have to ensure that these things are looked at, and then necessary action is taken. And once you come to the end of the study, you have to ensure that the data is collected, looked and relooked again, and ensure that the data is complete and that you have not missed anything. And then you have to analyze the data, take the help of your statistician, ensure that the deviations are being accounted for, and then you have to come to conclusions. As we keep on repeating, come to the conclusions based on the data that you have. You cannot come to conclusions based on data of somebody else. So your data should promote or substantiate what you have set out to say. So at the end of the study, if there are no difference, you should state that there is no difference between the two groups. That itself is a conclusion. You don't have to always prove that there is a difference. If you set out to prove it but you couldn't, you still can admit that there is no difference between the two groups, and that is a conclusion of the study. And then you present the data that you have in a conference and subsequently write it up for publication. So doing research has a lot of benefit. most of it is for you to go to a conference and present it and get recognition for that, and then you can also publish the data. Then now let us come to how to write a scientific paper. So once you have actually done the research and once you have presented in a conference, then you have to set about writing this particular the study that you have done to a in a journal. So how do you start? As we already said before, you should have the enthusiasm, the inclination, the energy, and the drive to write. So it is extremely important, because I think we see a lot of our students have done a lot of good work, but they are very reluctant and they are very hesitant to write. So it is important for you to push them, but actually you should not push them, because it is actually it has to come from their own volition, because anything that comes from within always works better. So it is important for everybody to want to write, and then for that you should, as we said before, we should keep on reading papers, so you get good ideas from other papers, and you also get an idea of how to write a paper and what are the good things about a particular paper. So these journal clubs will inspire you to understand what is the meat of the paper, how to write it, and how to actually get it accepted. So that is why doing journal clubs on a regular basis has a lot of benefits. One of them will be to for it to help you how to write a paper. And then, as we keep on saying, textbook reading is important for your foundation and basis, but you have to do collateral reading in journals, in compendia, and in research, this one, because it is extremely important for you to broaden your horizon and to look at what is currently going on. So there are many types of publication. The original articles has the highest value. That is the article that has come from doing an original study, be it a prospective cohort study of a large and a good cohort, or a prospective randomized controlled trial, or if it is then you have reviews. For example, reviews of let us say there is a particular problem where you cannot get uh, numbers in one randomized controlled trial to prove a particular point. A very good case in point, I never tired of telling this, is the question of whether bowel preparation was required in patients undergoing colorectal surgery. So a journal article in Lancet in 1971 said bowel preparation is mandatory. I don't think there was any justification for that, but it was accepted as gospel truth and it carried on. And in the 80s, people started questioning whether actually bowel preparation is necessary or is it warranted. And when the studies were done, majority of the studies showed that there is no difference, and there were differences which were not statistically significant. So then when they did meta-analysis and systematic review of multiple randomized control trials which were conducted in a good fashion, they showed that actually bowel preparation is actually harmful to the patients, apart from in select group of patients. So this is the advantage of reviews and meta-analysis and systematic reviews. Then, as Dr. Lakshman has alluded, editorials usually written by authorities in that particular field, and they usually give you the gist or the essence of the particular, or the flavor of the particular topic, and give you what are the pros and cons. And even though they are for a particular procedure, they are quite unbiased, and they will actually state why a particular procedure is good or bad. It depends on what they are actually reviewing, but editorials are actually a good fount of source of knowledge. Then case reports are not so, but case reports of extremely rare or important with a good message may be accepted for publication, but by and large journals do not accept case reports just because there is that you have actually sent it to them. It should have a particular value. And then there are very experts in the field will be invited to write a particular about how I do it, and these are usually not in the journals, but generally in the conferences where you have videos of invited guests who will explain why and how they do this particular procedure. Occasionally you do get it in journals also. If there are any instrument innovation, you can see articles like that, technical innovation, and interesting photos. So these are the types of publication that you see. Now coming to how the articles are actually looked at. So let us do this reverse engineering bit, where your article has reached the chief editor of a journal, and what does the chief editor now do? What he does is he looks through the article and says, this is not any good, let us reject it. So that's the end of the story. It is rejected. By and large, he doesn't do it unless your article is, maybe does not subscribe to the ethos of that particular journal, or is irrelevant to that particular journal, or it is not of good scientific and content. So he may reject it straight away, but generally it doesn't happen. What he does is to then send this article to this associated sub editor, who will then look at this paper and send it to a series of reviewers who look at this journal and then give their comments about what are the good points of these journals. Just like we do our journal club, they look at everything, and then one of the three things happen. At the end of it all, they may reject the paper and say, this will not be published in this journal. It is quite common. As we said, it's about 70%. Only 30% of the articles are accepted. But by and large, what happens the most is the modifications. I think even those 30% which are accepted will not be accepted straight away, because there are never articles which are that good that will be accepted, without any change. So they will say this is worth looking at, but you need to do these modifications. You may then look at what are the suggestions for the modifications and may find them plausible and reasonable, and that you actually, your thought process is similar to what they say. In that case, you make those modifications and resubmit it for publishing. And by and large, once they look at all the modifications you have done, and if they are happy, but they will go through the same rigorous process, and then they will say, okay, we'll accept this for publication. But sometimes you may find that their objections are not in resonance with what you think. Then you can actually very humbly and very, in a acceptable manner, write to them to say, this is the reason why I have put these things, and I don't really agree with your objections. They may accept what you say, and then they may accept your article, or they may again beg to differ with you. So you can then find a medium ground and then decide whether you want to resubmit your paper to that particular journal or take it to another journal. And once all these modifications are done, by and large, your article will be accepted. So these are the three things that will happen to your paper. So what you need to write a good paper is a good research question. So as we said, when you draw the protocol, you should have a good research question which is applicable to your cohort of population, which is something which is applicable to the time that you are working in, and then it should have a good protocol. This type of study should be good. By and large, randomized control trials, large cohort studies will be generally accepted for publication. The statistics should be good and should be applicable, and they should be right. If they are not right, even if your methodology is good, if the statistics is not good, you may come to wrong conclusions. So always use the help of a statistician, and there should be good discussion. The honesty in your reporting, the discussion should be honest and good. You should yourself volunteer to say what are the good points of your study, what are the shortcomings of your study, where you can improve them, and what is the future course of action you would actually like to suggest to them. So, and then the conclusion should, as we said, should be based on hard, good data that you have actually produced. So the anatomy of paper will entail a title, and then the author details, who are the authors of the thing, and then coming to the IMRAD, the abstract. I will talk about the abstract later. The IMRAD means introduction, materials, method, result, and discussion. So this is the meat of the paper. Then conclusions, acknowledgements, and references. So let us go to the title. So before you write the article, I would recommend that all of you use this, the ICMJE, which is the International Committee of Medical Journal Editors. So this is a fantastic website which will give you a lot of information, insight about the thinking of the journal editors and how you can write an article and what are the things that they're expecting of you and how you can modify what you have written. So they give you a lot of information, and the content is very good. So I would recommend all of you look at this before you actually start publishing. So these are the important references. As I said, the ICMJE, and then the British Journal of Surgery, how to write an article. And so basically all of these things will give you good references as to how what is expected of you when you write an article to this particular journal. Now, coming to the title should be catchy. It should not be gaudy, or it should not be, but it should be catchy, that it will take the attention of the person looking at your article. So it should generally try and avoid full sentences and questions. It should maybe leave it as a phrase, and then make sure you look at that particular journal that you are sending this particular article to see what are the kind of titles there are, because some of the journals may not like very flashy titles. So you have to ensure that you don't send a flashy title to a particular journal. That itself may put off the editor. So it should be important for you to see what is the kind of titles that you see in that particular journal, and then make sure the importance of the words to begin with and to the end, to sort of surmises, or basically it actually shows what your article is about. So the title is extremely important. Choose it wisely. Then coming to the authors, see, the ICMJ recommends that the thing is, it is a common practice that you scratch my back, I scratch your back. So basically you include me in your paper and I will include you in my paper. Those days are gone. I think it is important that you are actually part of the process of the study. You have to have done something substantial for your name to be included in the study. So substantial contribution to the conception, design, acquisition of the data, analysis of the data, and if you are part of the operating team that does a lot of operation which contributes to the thing, so only such people should be in the authorship. So I think that is important. It is a part of being honest with the journal that you are sending the article to. Coming to the abstract, though the abstract, you should understand, it is the most important part of the journal, of the article. If you write a good abstract which contains all the necessary information, then the chances are that somebody will read that particular article. So you actually, though the people read it first, you should write it last. You form the paper, you've done your study and everything, you write the paper and then write the abstract last. And you should make sure that the abstract contains all the information, the introduction, material, methods, results, conclusion, and then you should actually focus on the meat. What is the information that you are going to write? So it's extremely important. And then coming to the introduction. So as I said, so you have to actually introduce your article by saying why you are doing this particular study, what is the current available literature, what is the current available evidence, and what are you actually hoping to contribute to that evidence. Why are you planning to do this study? So that is the background information to the study, and what is actually lacking. So for example, as I told you, TEP and TAP, there is in the good Indian data on long-term recurrence rates for TEP and TAP is lacking. So if you do a study like that for a period of 5 years or 10 years and then publish the data, then it is actually going to help the world literature, or at least the Indian literature. So it is important why you are actually doing this. So you should state what is lacking in the field and why are you doing this particular study, and the aim of the study. So this is important, and these are the things that should be included in the introduction of the study. And then coming to the materials and methods, you should state clearly whether it is a prospective observational study, cohort study, and then what is the kind of population that is being studied. Have you got adequate numbers? Then you should very clearly define the inclusion and exclusion criteria. When you do the inclusion exclusion criteria, and at the end of as we said, when we do this the CONSAT diagram, you should explain why certain people were excluded, and if they are excluded in the middle of the study, you should actually explain why they were excluded in the middle of the study. And then the methods that have been used has to be detailed, and it should be reproducible. And then you also have to quote the equipment source, if whatever equipment they have used, because it shows the transparency in your writing, and also it will help somebody to do the study if they're interested in doing what you have actually done. And then you should also give all the permissions that you have obtained from various ethical committee and everything, so that the people are clear that you have done all the right things. Then this is the strobe. I don't think I need to elaborate on the strobe statement, but strobe statement is it's a group of the epidemiologists who are looking at how to report the data. So basically, if you follow the strobe statement, then by and large you are doing a good job. Now, so as we said, the reports of the results have to be done fully and honestly, as you have specified before. You should you have the text, you should have the tables as an evidence, and then you should have the figures which will back up your evidence. And so you have to ensure that everything that you have done in that particular study is actually reported and given in these forms. That is, the text will contain the story, the tables will give you the evidence, and the figures will highlight what are the evidence that you have shown. Then you have to report the primary outcomes and describe them. What is the primary outcome of your study? Then you have to give the confidence intervals for the main results. For example, what is 95% confidence interval, whatever the confidence intervals are, odds ratio, all of these things have to be given very carefully. And then the statistics have to be reported, and if there is any difference, why that difference is there. The statistics have to be explained, why you actually chose that particular statistics. So the statistician will help you to do that. And then if there are a lot of tables and figures, you can omit them, but you should maybe send it as a supplementary file to the editor for them to look at. If they want to look at and consult them, it is there. But many of the details may not be necessary, so you should put it in the separate file. And then don't start when you're giving the results, don't start the discussion there. You are only stating facts here. When in the result column, it should be statement of facts. Coming to discussion, you should not again go back to introduction and keep on saying about the same thing. You have to explain the principal finding. For example, the difference between TEP and TAP. So what was the difference? So you explain that in detail, and then you have to comment on the strengths and weaknesses of the study. What is the strength? It's a prospective randomized control trial. Generally, it's a good trial, and it will have a lot of strengths. And there can be weaknesses. You have to elaborate and highlight them. And then then you have to have a collateral reading and quote other journals, quote other articles of similar nature conducted in other countries or in different place in your own country, and compare them and say what are the strengths and weaknesses of your particular trial and your study compared to the other trial. So that is also very important. That shows you're honest, and also shows that you have an insight about comparison between the two, and see what is the perceived or the real difference between the two studies. And then the potential implications for the policymakers and clinicians. If you show that your particular study is that good, then you can actually go to the policymaker and make them to change. Even it may not be in the national level or state level, even in your own hospital level. If you show a particular operation is better than another operation, you can go and tell them this is what we should be doing all the time, and this is the equipment we need. So policymakers in your own hospital may be convinced about the study. So that is why it's important. And then if you feel that some of the questions have been unanswered in your study because you didn't think of them, or it was not in the scope of your study, or you didn't have enough numbers to answer that question, you can actually quote that in the end and say the future direction of the research could be along these lines. And then references. So it is important to have all the references. You can either quote them in the form of Vancouver or the Harvard systems. Both are internationally accepted. Why should you do this? One is, it is important, ethically correct to acknowledge others' work. So if at all you have quoted other people's work, it is important to acknowledge that you have quoted their work, you have looked at their work. So that is the first thing. And it is also a legal requirement. It is important that any journal will ask, where is your reference? So you should quote the particular reference that you've taken, the journal and everything in the Harvard or the Vancouver system. And then it will also prevent you and help you to fight the allegations of what we call as plagiarism or theft. So it is important, if you have quoted that particular journal and the information that you have actually gleaned from it and quoted that, and you have taken the necessary information from them, then nobody can accuse you of theft or plagiarism. So it is, again, it is important. And then it also shows that you're willing to read, willing to learn from others, and then see what good that they have done can be reproduced here, or we can carry it forward and take a step forward, take one or two step forward from there. So it is important for you to read. And then, as we said, if for example it's following a particular sequence, so you may do the next step of the particular study. For example, if somebody has looked at only short-term outcomes of a particular procedure, you can then look at the long-term outcome. So that is a sequence of the event, or and also it may be a parallel opinion for a particular study. So that is why it is important. And then if you have already quoted the references, you may not, for example, if you are in your article, you quoted a particular reference which details TAP procedure and TAP procedure in detail, you can just quote that reference and say, as indicated in that particular paper, we followed the same procedure. So it will shorten your paper, because most journals will have a set number of words that your paper should be confined to. So if you do that, then you can shorten your paper, and you will use the space to explain your procedure better, or your results better. Now there are many citation managers which will help you to glean the data from the available international PubMed or wherever else it is there, Scopus and all that. And then there are paid and free versions available. For example, Zotero, Mendeley, and EndNote. They will all help you to manage the citation and the reference and indexing. So this is the procedure with which you do it, so that you collect the data and then you interface it with the website, and then it will finally give you a version which you can print at the end of your journal article. So coming a short, this one about plagiarism. Plagiarism is portrayal, claiming, or use of another person's work, idea, sentence, thought, whatever, and without specific reference to the work. So in the academic world, plagiarism is considered to be a theft. It is dishonest, irresponsible, and illegal to do so. So it is extremely important. See, generally it is taken if your article, when there are multiple plagiarism checks, the websites, check sites that are available, if your article contains more than 30% of work from elsewhere, then it is considered to be plagiarism. So it is important. It is either in the form of text, mosaic plagiarism, or plagiarism of idea, or self plagiarism. For example, if you have written something and you have again tried to use the same idea to do something else, that becomes a self plagiarism again. So I think you should be very wary of this. Plagiarism can happen because of lots of things, which is unintentional. You don't know that you are actually quoting somebody else, and you've done this without, either it is lack of knowledge, or you have not quoted the right references, or it can be intentional. So if it is intentional, again it is bad, but ultimately, whether it is intentional or unintentional, it is considered to be illegal, and it is considered to be theft. So there are what are called as plagiarism checkers, which will be used by the journal editors, and it easily picks up copied content. And if they find that you have done plagiarism, they will summarily reject your article, or they may even report you. So it is extremely important that this is commonly done in the universities, in the thesis and things like that. So whenever you do research, make sure that you are not copying somebody else's content without referencing them. So now coming to, once you have written the article, as I think Dr. Lakshman has already alluded to this, you should better always publish in an index journal with a good impact factor. Avoid predatory journals. These will be available in the website of the DCOJ, which is the directory of accredited and open access journals. So that will contain all the predatory journals. Or if this particular journal is not in the DCOJ, that means it's a predatory journal. So you should avoid predatory journals, that is journals which will take money from you and publish. So these are not peer reviewed, and there is no quality control, and these are not accepted in either in the literary world, in the academic world, or as a, for example, if it is as a prerequisite for your promotion or whatever, they are not accepted by the universities. So we check the DOAJ, that is directory of open access journals. If these journals are not on that index, that means they are predatory journals. So avoid publishing in them. So this is the DOAJ website, and it will give you all the index of all the journals that are there, which are open access journals. So use them. And it is extremely important. If you are going to publish in BJS, go to the section of instruction to authors. Read it very carefully, read it verbatim, and ensure that all the requirements, specifications, and instructions are adhered to correctly. Because if it doesn't, it will straight away ask for rejection. So it is important for you to read the length of the abstract, length of the article, referencing, number of references, photographs, all these things are very clearly laid out by the editors of the journal. Ensure that you read it properly and adhere to those instructions. And I think, Doctor, this has already been, rejection is a way of life. I think a lot of us get rejected when we start publishing. And as Dr. Lakshman said, even very late in the career, you can get rejected, but don't get disheartened. The rejections may be due to many reasons. It may not necessarily, go with the ethos of that particular journal. It may not be a question that they want to address at that particular time, or it may not be, for example, what is applicable in India may not be applicable in England or in America. Similarly, what is applicable there may not be applicable here. So you have to ensure that you don't get rejected when somebody rejected your articles. Many of the journals may give you the reason why it has been rejected. Look at it carefully. See if whatever suggestions, clarifications have been made. If you can change them, change it, and then think about whether you should send it to the same journal or different journal. But if you keep trying, the number of rejections will come down. Enthusiasm, perseverance, hard work, and never say die attitude. All these things are important for you to publish successfully.
Well, thank you, Dr. Ravi Shankar. That was a very detailed account of how to go about it. Yes, there are plenty of little points to be noted, and I'm happy you covered almost all of them. I was just waiting and I was hoping you would not miss the very important instruction about writing of papers is read the author instructions. And every journal has its own pages and instructions for authors. And it is very sad that very good articles get rejected out of technical details, failure to have adequate spacing, failure to not do the referencing in their system, and other little technical details. So please see, the first instruction is to, or on going to write a paper, is to make sure you know which journal you're aiming at and what that journal's author instructions are. I would like to tell everybody who's here that these lectures are available on the website. They are now going to be on the LGS platform also, as well as these EBS modules are available on our Karnataka State website, kscasi.com, and they are also downloadable and available for free. It is very great work of Dr. Lakshman to put all these things together, and you could always look at them and read them and follow the instructions. In a lighter vein, I have put out what Dr. Ravi Shankar spoke about on the various steps it takes to achieve this process. It's called thesis writing made simple by some CS type of instructions. And that also is available on the LGS platform, so people can read it. Messages, any new messages? What is your take on international journals? Do they carry any value at all? No, okay, that we've answered. These are just words of thank you, and thank you very much, sirs, for our work that we have done. I'll hand over to Dr. Patta by saying, sir, we have come through these modules for evidence-based surgery. Big thanks to Dr. Lakshman and Dr. Ravi Shankar for today's talks, and to Dr. Shivaram and Dr. Ramakrishna for the talks on the first session. And we should have this as a repetitive program once in 3 months or once in 6 months, because if you look at the number of people who logged in, it was only about 15 to 20. It went up to a maximum of 24. So there are a lot more people who need to benefit by listening to these things. We don't mind doing it as a repeat performance. Thank you, Dr. Patta, sir, for allowing us to use
Thank you,
your
sir. Thanks for a very complete, comprehensive discussion on journal publishing. And thanks. We'll see you again sometime soon. Thank you. Thanks.
Thank you, Dr. Patta, for giving us this opportunity.
Yeah.
I think it's very nice
Thank
of
you
you
very
to
much, sir.
accommodate us. Thank you very much.
Pleasure,
Thank you
sir.
very much,
Pleasure.